Many times, doctors, nurses, and other health workers feel invulnerable, but it is hard for them now to see their colleagues who have caught the coronavirus die in other jurisdictions. But it is a commitment to serve humanity that is keeping hope alive, and it shows how brave these people are for showing up every day and doing their work.
My medical director in particular cares about the people, and while his jurisdiction is the doctor, so I can speak only as a doctor, and they make sure that you take care of yourself. I have one colleague who, as we say in Chinga, it's not many just to Dr. Susan Siabi, but she makes sure that I do the right thing. Sometimes I forget I'm going to hug someone and said, I'm a social distancing or this, or you looked at it. We look out for each other. Someone doesn't see you for a couple of days, you get a call to make sure that everything is okay.
I am Komla Adom, and I have come to the University of Ghana Medical Center, where I have been granted exclusive access to visit the treatment facility for persons with COVID-19. I meet Dr. Emmanuel Amoah and Dr. Amma Edwin, who are directly offering care to some of the patients in this facility. Before they go into the treatment facility, they need to be appropriately gowned. In fact, personal protective equipment, what we famously call PPEs, are precious now, probably counted like narcotics. But it is for good reason. We are about to find out how much.
We are going to wear our full PPE. The reason is simple. When we go in there and then anybody needs any care, because we are in full PPE, we can offer the level of care, the needed care for every patient. If you are not fully donned, then when you go in, there may be some procedures you may not be able to do because we are not in the appropriate personal protective equipment.
But Dr. Amoah and Dr. Edwin do not don their PPEs unguided.
We have supervisors here whose sole responsibility is to make sure that healthcare workers are donned properly before they go to offer service. So they will read you the steps and you dress appropriately before they can tell you that now you are okay to go. So now we are going to turn you today also to frontline health workers, possibly give you the full PPE for you to appreciate what healthcare workers go through when they need to offer care for COVID-19 patients.
You know me, I told you that I'm up for this, so no problem at all. I'm ready to also, don the PPEs. It's going to be a revealing, experience for me as well. So what you are seeing now is a session where the doctors are donning their full PPEs, of course being supervised by people who are designated to supervise the donning of the PPEs. As you can see, it's actually not a child's play here.
I did not check the timer, but this careful and thorough process lasted more than 30 minutes for us all.
I have to tell you that it's not an easy process. My camera technician, Sami Asante, is here with me. Sami, are you sure you can breathe?
I'm managing.
And I'm going to go in the treatment area with Sami Asante, also with Dr. Emmanuel Amoah and Dr. Amma Edwin. Come with us.
These doctors and nurses do not just walk in and out of a treatment facility.
You have to plan the care. What exactly are we going to do in there? So that when you go in with, let's say, a doctor and a nurse, we'll finish all that has to be done for the patients before you come out. Because we want as minimum exposure as possible.
Dr. Amma Edwin has taken the lead. She's interacting with some of the patients and probably seeking their consent to have us come by.
We have some of our patients here who are willing to talk to you.
These two patients are doing well.
How are you doing?
I'm doing better. Yeah, sure, everything is going well and we are under the treatment and we are getting better.
I actually wasn't breathing properly, so I had to come in so that they can monitor me properly with oxygen and so on, support.
Akai and Polo, as I choose to call them, say the health workers, including Dr. Amoah and Edwin, have been truly helpful.
As I'm here for past 1 week now. I was suffering a breathlessness, but because of the doctor's team over here and the staff management, I'm getting better over here.
Oh, doing well. The doctors have been very supportive, and the jacks have been working, so we're fine.
It's been several hours of working around the clock and sometimes on shift basis to offer care to those still here after some 18 others were treated and discharged. The expectation is that those who are here with mild to no symptoms will recover soon enough to be discharged.
We sort of try to give them the needed psychological support counseling through Dr. Edwin, and the little that we can also do. And then when we discharge them, we plan their discharge carefully so that we take them home into the community without them being noticed that they are coming out from the hospital. We are trying to help people to also appreciate that it's not the fault of anybody to be infected with COVID-19, including healthcare workers. So we need to be confident about what we are doing and also to try to support those who are infected to recover fully and come back to enjoy their life they are already enjoying.
While these health workers give off their best, they also give up their invulnerability. More than 10,000 of them have been infected by the disease globally. In Ghana, some doctors and nurses have been compromised too. But Dr. Amoah and Dr. Edwin are upbeat, with their sights firmly set on treating others to get better.
This one would affect anybody. I don't know anybody who would not be affected. And even those of us, Dr. Amoah and I were changing stories and laughing. We both had our samples taken on Thursday. He had some symptoms. I had some funny cough, itching in the throat. My son was sick, and then suddenly my mind was playing tricks on me. I had to calm down. My husband had to calm down. Even said, so the worst case scenario, you've got it, so what? I mean, we will handle it. So the psychological impact is real.
This is their simple message.
This is a new virus with so many unknowns, but that community of care that has developed among the patients themselves and among even those of us working here, we look out for each other, we encourage each other, we support each other. That's how we beat this. We need to be there for each other rather than stigmatizing people and their families and even healthcare workers working in the front line.
It ends for us here, but not for Dr. Amoah and Dr. Edwin, who now have a whole new routine, even at home.
My routine is I will remove my Crocs, clean my Crocs, there's a place I put it, and then I'll go straight to my bedroom and go and shower before I come and hug my children and get into things. Sometimes it's just a matter of we want to get into the habit. As much as we take precautions here, you also need to be mindful that you work in a facility where you are treating patients, and that for me is more for the benefit of my family.
And that is how it is going to be for them for as long as coronavirus remains with us. Such is life on the front lines. Komla Adom, Joy News, UGMC, Accra.